Welcome everybody to the Health Equity Committee Listen, Learn, Empower workshop series, exploring health equity and barriers to healthcare for people in Ohio and in our nation. The focus this evening is on Medicaid, a system that aids in providing access to healthcare, and how Medicaid helps people with disabilities. I am Nancy McCrickard, your host for this evening. Bob Crazen is the co-host. We are members of the Health Equity Committee of Healthcare for All Ohioans, the Single Payer Action Network Ohio, or SPAN Ohio, advocating for healthcare for all. Our two speakers this evening are Kathryn Poe, Budget and Health Researcher for Policy Matters Ohio, and Barbara Safaris, Independent Consultant for People with Disabilities. Before we hear from our speakers, Bob will give a brief introduction to Healthcare for All Ohioans for those of you who are new to our organization and workshops. Bob?
Thank you, Nancy. Healthcare for All Ohioans has the purpose to reform healthcare payment and provide excellent healthcare to all U.S. citizens and residents. We want to join 58 other nations which already accomplished this. Our healthcare payment system is convoluted. It's a mishmash of public healthcare, which pays for healthcare for about 60% of us, private insurance, which cares for about 30% of us, and the other 10% go without. We are saddled with payment complexity everywhere. Hospitals need almost one financial clerk for every person admitted to account for every aspirin and Band-Aid the person uses and analyze what insurance she or he has. Doctors have to play mommy may I with insurers, taking 20% of their time, seeking pre-authorizations for valid therapies for their patients. Nowhere else in the world is there pre-authorization. Who ever heard of such a thing? We, the people, are avoiding going to a doctor because of costs, because of high deductibles, co-pays, even with the public systems. Healthcare for All Ohioans wants every person to be able to go to see a doctor or visit a medical provider with no exchange of money at the point of delivery of care. No co-pays, no deductibles, no out-of-pocket costs. I hope that you will go to our website, healthcareforallohioans.org, and check out the federal and state legislation we support, which are Medicare for All and the Ohio Health Care Plan. Please join us. You are needed in this struggle. Nancy?
Thank you, Bob. And now to introduce our first speaker, Kathryn Poe. Kathryn Poe is the Budget and Health Researcher for Policy Matters Ohio, focusing on the state budget and health policy. They have a Bachelor of Arts in Creative Writing from Capital University and are currently a student at the Ohio State University Wexner Medical Center, working towards their master's degree in bioethics with a thesis on medical disinformation and conspiracy theories. As a bone marrow transplant and rare disease survivor, Kathryn is passionate about working with other patient advocates from around the state on topics like medical debt and access to health insurance. Kathryn previously worked on public policy at Equality Ohio. Kathryn has a wife and 2 cats. Kathryn?
Hi, everyone. I'm happy to be here with all of you today. I'm just gonna share my screen. Okay. Can you all see my slides?
Yes.
Okay.
Yes.
Just so that you know, my other screen is right above my computer. So if you see me looking above, that's what I'm looking at. I'm trying out a new configuration of my like laptop. So, but hello, it's really nice to see all of you here. Thank you for joining us on a Thursday to talk about Medicaid and the budget, which can be kind of technical at times. But I always tell people that Medicaid is such an important service. And before I start all my presentations, I usually say like, I got my undergraduate degree in creative writing, and policy and the budget were never things that I thought I was going to do. So if I can learn how to do them, you can also learn how to do them. So if you have questions about technical terms, please feel free to ask. We're all here to learn. There's no shame in not knowing what something means. So first, I'm just going to kind of talk about Policy Matters Ohio. So we are a nonprofit research institute. We're located in Columbus and Cleveland, and we typically refer to ourselves as a people's think tank. So we take the advice and the feedback of our organizing organizations that are out in the field, and we turn that into public policy. We are typically an organization that focuses on the budget, economics, and tax policy, but we also cover healthcare. I am our state budget researcher, which means that this is a very chaotic time of year for me. I've been at the State House all week thinking about the budget. So, we're going to talk about the state operating budget and the Medicaid portions of that, but we're also going to talk about the federal reconciliation budget, which I'm sure that all of you have seen in the news. So we're going to talk about both of those things tonight, but just to kind of level set, we're just going to start off with like the basics of Medicaid. So, what is Medicaid, right? There's Medicaid, there's Medicare. I, until like starting in this job, would get them interchanged. Medicaid is the state healthcare plan that is combination federal and state dollars. And it typically is for folks who have limited income or have a disability. You can enroll in Medicaid at any age. This is the difference between Medicaid and Medicare. Medicare is for older adults, typically over the age of 65. And, you don't technically have to have a disability in order to enroll once you meet the age requirement. But for Medicaid, you have to meet very specific qualifications. And typically, people who can actually get on Medicaid are folks who have the lowest of the low incomes. Now, this varies from state to state. If you're in a state like Texas, it's super difficult to get on Medicaid. If you're in a state like California, it's less so because states are able to kind of change their eligibility. But in Ohio, this is what our eligibility looks like. So there are different categories of eligibility based on why you are on Medicaid. But for most adults ages 19 to 64, you have to have an income less than 138% of the federal poverty line. Now, what does that mean in like actual tangible like examples? So, for example, my wife works at a coffee shop. Most of her coworkers working full time are below the threshold and would qualify for Medicaid assistance. So that is about typically an hourly wage worker working full-time to part-time is going to be around the threshold, just to give you an idea of where most people sit. Now, this is also higher for folks who are pregnant, folks who fall into the aged, blind, and disabled category, and then also children have separate qualifications. You might have heard of the CHIP health insurance program. That is the children's program in the US, and you can get onto that for having, really large health needs or because you have a parent currently on Medicaid. So this is an example of the actual like breakdown for eligibility limits for different families and the percentages of income, just so that you can kind of get your head around who we're necessarily talking about, right? And I always say, like, in Ohio, you have to keep in mind that our median income is around 55 to $60,000 a year. So a lot of Ohioans actually qualify for Medicaid, especially if they have larger families and they're living on one income with multiple people. And so it's not, I think that when we think about who is low income, we're not necessarily thinking about our neighbors or the folks that we see every day, but this is often the case. A lot of Ohioans are on Medicaid. It's a huge healthcare system. It's a huge part of our economic stability in the state. Medicaid covers more than 3.2 million Ohioans. That's a huge healthcare program. And that is over 4% of Ohio's economy, right? So it contributes to a lot of our economic stability, which I think is maybe an understated part of when we're talking about Medicaid. We don't really think about its greater economic impact, but it has one, right? Because people like my wife, who are service industry workers, they don't have health insurance. They rely on Medicaid to get by, which is often why people can take those kinds of roles. And so, especially for our lower wage earners or our hourly workers, Medicaid is how a lot of them get health insurance. I also like to point out that Ohio's small towns and rural areas, about 29% of children are covered by Medicaid and CHIP. So it's also really important for our kiddos, especially. Um, I have often been really shocked by the sheer amount of demographic um, like change in who is covered by Medicaid. So this is a map of the state, and you can see where Medicaid coverage is the highest. It is also typically in these, like in the Appalachian region of Ohio, you have a lot. But you also have it centered around Cleveland and Northeast Ohio. There are a lot of folks on Medicaid. And so when you're thinking about places that will be disproportionately impacted by the cuts that we're about to discuss, there are very specific regions in our state that will suffer. And so those state lawmakers and Congress people should probably do a better job. So we're going to talk about three specific cuts to Medicaid. There are a lot of other options on the table, but like this is kind of the menu of things that they could do, things that they're considering. Um, the first one that most people have actually heard of are Medicaid work requirements,
Mhm.
and they are what they sound like. So there are two versions. There's the state version and there's the federal version. Right now, in our state budget, we have a proposal to enact a Medicaid work requirement on the state of Ohio. This work requirement is based off of ones that have been around for a while that were passed in places like Georgia, Arkansas, and New Hampshire. And these states have seen substantial harm to their Medicaid program and the amount of people that they're able to cover. Because while it might sound intuitive, some people believe, well, if you're going to get Medicaid, then you should work. The problem is that that's a very chicken and the egg kind of a situation, right? Which one comes first? Well, it turns out that in most situations, Medicaid actually has to come first because people have to be able to access health insurance in order to stabilize themselves and get themselves into the workforce. And so by causing this substantial administrative burden, these programs often kick people off of Medicaid and then make it more difficult to enroll. So then you might be saying, well, what's the difference between the state one and the federal one? So the federal one is essentially that it would require all states to have a consistent federal work requirement. So all states in the country would have the same one. However, the one being proposed in the reconciliation bill is actually more extreme. And it's more extreme because of the amount of re-eligibility determinations. So essentially, how many times they have to check that you're eligible. If they have to check that you're eligible every year, then you only have to submit paperwork every year. But in the reconciliation package, you would have to submit twice a year, right? So you're constantly asking people to re-up their status and prove that they're eligible for Medicaid. So there are some other tinier dis differences, but essentially we have both a state requirement and a federal work requirement on the table at the moment. And it's notable that if the federal one passes, it will preempt ours. So in both scenarios, we get a work requirement. And that is something that looks actually rather likely to pass, unfortunately. The state one was in the current state budget as it was put through the House and Senate in Ohio yesterday. And then the federal one is in the reconciliation package being considered in Congress right now. So that's just one area of cuts, right? Because I think Medicaid is such a big program that they have a lot of ways to tinker with it, but all of those things are cuts, no matter how they do them. So the other way that they could cut the program is by influencing the federal match rate. So, like I said, Medicaid is a state and a federal program, and they latch together. And depending on what kind of coverage you have, the federal government pays more or less of that coverage. So, if you're in this Medicaid expansion category that was created by Obamacare, that's what most young workers or people in the workforce are on, is this very specific part of Medicaid. If you're in that part of Medicaid, the federal government currently pays 90% of the cost. And that's a pretty good deal for states because it means that states don't have to pay that much and they get to expand coverage. That was kind of the original deal. But a Medicaid FMAP, which is the federal match rate decrease, essentially means that the state's going to have to pick up more of the tab. And that's a bad thing because states like ours have not calculated that. We have not mathed that math. We just went through a whole 6-month process in order to put together what we think our budget's going to be like. And this is not in that budget. We have not set aside those funds. So if Congress does this, then it shifts a substantial cost burden to the state that we're going to really struggle to afford. And it's going to mean that people in Ohio lose their health insurance because the state, rather than covering that cost shift, is simply going to end the coverage. And so when Congress acts and pulls funds away from Medicaid, it often means that states will simply shut down the coverage mechanism that they were using to provide that care rather than shifting their government, like shifting their costs around in order to cover it. And how would this matter for Ohio? Well, it's about 700,000 people that would lose their healthcare coverage if we were to get an FMAP production. Now, there's some good news and there's some bad news here. So, the good news is that the federal government currently doesn't look like they're going to touch this. This is not possibly in the reconciliation bill. They've been batting it around as an idea, and it doesn't really seem like it's going to make the final cut, which is good. The bad thing is that Ohio has put a provision in our budget that is passing this week that essentially says that if they ever do that, that they will immediately eliminate the entire group. So while this isn't an imminent threat now, Governor DeWine has essentially put a landmine in the budget for future generations, for future governors, which will immediately cut off coverage should it ever be reduced. So for now, we have to wait and see, but this is a enduring possibility because of what the state legislature has chosen to do this recent budget. And then the third one is honestly the most niche. I'm going to talk about state provider taxes. Do not let your eyes glaze over. I promise I will be quick. So long story short, states are allowed to tax medical providers in order to pay for their Medicaid programs. And a lot of hospitals are actually in support of this tax because they pay it to the state. The state uses it to pay for Medicaid. It's a good cyclical system. And a lot of those dollars get distributed to rural hospital systems. So they really bulk up the entire system. And it allows Ohio to draw down additional money from the federal government. So we draw down about $9 billion from state provider taxes. But one of the things that this reconciliation bill does is it changes how states are able to raise taxes that fall into this category. And that's bad because that's a core way that states like Ohio, many states, I think it's more than 37 states, raise these kinds of taxes to pay for their program. And I always say that this is like the sneakiest one of them all because it's niche enough that I don't think that people pay attention to it. But this is also a way that they're able to cut the program by limiting a state's ability to bring in money to draw down more funds. It's essentially another Medicaid cut. So Ohio actually right now is trying to increase our provider tax rates because we need more money from the source. And so the federal government is about to come, possibly, and say, well, no, you can't do that. And so this is a great example of how the federal reconciliation bill is putting state budgets into a really tight spot all over the country because there are notable contradictions. And this is one for us in Ohio that's a really big contradiction. And there's not necessarily a lot of guidance about how to resolve those issues. So I've talked a lot about the federal reconciliation bill. This tracker by KFF online is like just alive on my desktop at all times now. I highly recommend it if you're interested in like getting into the nitty-gritty of what's in each version of the bill. But right now, the federal reconciliation bill includes federal work requirements. It includes limitation on providing Medicaid to immigrants and refugees, which has been a super common target of the Trump administration. It also requires additional eligibility determination, so adding additional administrative load. And there are some other things right now that are in there that there's quite a bit of debate over whether or not they're allowed to be in there. You might have seen in the news that the Senate parliamentarian in Congress struck down a bunch of provisions, basically saying that, they can't be included in the process, that this isn't the time or the place to do them. They have to be in a separate bill. And some of those were really good for us, including there's a gender affirming care provision that was struck out, which is great. So there is now some like question as to what is actually going to end up in the bill, but the core of the bill is still built on Medicaid cuts. That's how they're paying for everything. They're paying for the rest of the bill, tax breaks for their buddies by sacrificing Medicaid. And it's because it's such an expensive program. It's because there are all these different parts and pieces that can be shifted and changed. But mostly it's because they don't care about who they hurt. And that's very clear in their target of going after Medicaid, especially in places like Ohio, where it is like an essential economic asset to our state. So that is the end of my presentation. I'm happy to take questions now or wait, but thank you.
Thank you, Kathryn. Let's see if anybody has some questions they'd like to ask right now. Well, I was interested to see on your map that Cleveland was the main main place that would be harmed by these cuts. So of the rural areas, it was the only one.
Mhm.
Well, let's see. Gregory, do you want to ask your question?
Yeah, thanks. First of all, great presentation. Thank you for doing this. Um, in previous iterations of the work requirement was only uh, uh, it was only required for the Medicaid expansion part of Medicaid,
Mhm.
and people who weren't under Medicaid expansion, but were still qualified for Medicaid because they were disabled. They didn't have to do the work requirements. Uh, would they have to do the work requirements under these programs?
No, so that's a great question. So the short answer is no. However, um, so, and this is a very technical answer, but some states like Ohio didn't recategorize people when Medicaid expansion happened. So, what I think will also happen is that there will be folks who technically should fall under a work requirement, who, like the state of Ohio, has not classified properly, who would still potentially have their coverage questioned. So people in the broader system might have to go back and prove, like, hey, I have a disability, like even if you've proved it previously. Um, but it shouldn't, you know? So like if Ohio does their job well, if this were to be implemented, you wouldn't be, but that's going to be really difficult to do. So yeah. So short answer, no. Long answer, eh.
Thank you. Thank you.
Yeah.
Bob, you want to ask your question?
Sure. Thank you for verifying the convoluted nature of our healthcare system. Medicaid does dramatize that. My question or comment is, there was an article in the Dispatch today in which Republican members of the Ohio legislature have written to Republican members of the Senate asking them to go slow on this cut to Medicaid because of the closure of hospitals. And they listed 15 hospitals, I think 12 of which were in Appalachia, because of the cuts to Medicaid. Would you want to comment on that?
Yeah, so we actually put something out about this too. Um, it really is true that like I think that a lot of Republicans often conflate like um in a very racist way, conflate poverty with low income folks in the city, right? And so when people are talking about this issue, like in the public sphere, I think it's often a dog whistle, right? Because we think about, well, like poor Black folks in the city, like that's who they want their constituencies to think about are impacted by Medicaid. It's like explicitly a racist dog whistle.
Yep.
The reality is that it's actually mostly rural folks, white, working class, rural folks who are the ones that are actually going to be hurt by these kinds of policies. Now, that doesn't mean, right, that our more dense cities like Cleveland won't be impacted. They will, but um, it's actually the whole state. Like, and I think that the hospital piece of this really shows that that's the case. It's not who they see as acceptable to target. It's everyone, including people in their own districts.
Oops. Arlene, you want to ask your question?
I'm not sure I understand what the work requirement means.
Oh, Marlene.
Did you call me or somebody else?
I meant Arlene.
Arlene, okay.
Well, you'll
Well,
get your turn.
I'll wait.
Okay, Arlene.
Thank you. Thank you for such a great summary. A number of us were writing to our legislators to change the wording concerning the federal government lowering 90% of the contribution with changing the word that, instead of Ohio shall, like go away from this if anything is lower than 90% to the word may. And I wonder if that's could be a winning approach in the future.
So as of right now, it has not made it into the budget bill. It got rejected by the Ohio Senate. And um, I have to be honest, I think there were a lot of people really surprised by that. I will say that this budget was really brutal. There are people that I know have been working on the budget since like the 1970s who have said that this is the worst budget they've ever done. And I believe them. And it's because of things like that. Like, I think that in a past budget, that would have been seen as like a really reasonable, common sense proposal. But during this budget, it wasn't. And I think that really says something about like where we're at in terms of like the state legislature actually being willing to defend people's health insurance.
Thank you.
Well,
Linda, do you want to ask your question?
Like everyone else, I'd like to thank you too. The presentation's been very good. And my question is about the disability status and the qualification for Medicaid. If somebody's determined by Medicare to be disabled, do they automatically, with an income eligibility as well, but do they automatically get considered for Medicaid? And, it's a little bit about that dual eligible situation. Could you talk a little bit about that?
Yeah, so generally, it's really difficult to prove that you have a disability. So typically, if you've gone through the process and succeeded in one way, like let's say getting like SNAP benefits, that typically transfers to other state agencies because it's so difficult to prove that once you kind of have, typically they will respect it. And that can be like through a variety of different ways, whether proving that you can't work or having a signed doctor's note or having like a long-term history, a medical history that shows that. But it should transfer. So being declared disabled in one should follow to Medicaid as well.
Thank you.
Dina, do you want to ask your question?
Yeah, I had a couple questions. I know that when other states put the work requirement, a lot of people lost Medicaid. So I was wondering why that was. So was it because there were people that were disabled and weren't able to work? Because I can think of people like, for example, with mental illness, people with drug problems, people with disabilities like really bad arthritis where they can't, do manual labor anymore. So there's a lot of people that just can't work anymore for one reason or another, and they would get cut off Medicaid. So is that kind of why people are losing their Medicaid, because they just cannot work and they're being told you have to work to get Medicaid, and then in order to prove that they're disabled, it just takes so much that they're not able to do it? So that was my question. Why were so many people lose their benefits when their work requirement?
Yes. So a couple of things. And so maybe Marlene, this will also answer your question about how the Medicaid work requirements work. But essentially, um, so in order to apply for Medicaid right now, you have to go to them, you have to give them your information, and you have to prove your income. But if you make zero income, that's an acceptable thing to say.
Right.
Under this proposal, essentially, you have to be able to show that you either have some income or you're doing some other activity that would qualify. So if you're a student, if you're doing volunteer work in some way, shape, or form, there are a couple of things that could count toward your working hours. The problem is that you have to prove it. And that process of proving it takes a lot of time. So states often have to set up a whole system for how they're going to accept this kind of information and verify it. Because you just saying, me saying, I'm Kathryn, I worked this many hours this week, and just reporting it yourself, the state isn't going to necessarily believe that. They do third-party verification. So if the state of Ohio goes to your employer or goes to a third-party data broker and says, "Is Kathryn working?" They have to be able to verify that. And if they can't verify that, that could be reason for them to not accept your coverage. Something that often happens, so I'll use my wife as an example. So if you are an hourly worker and you work 10 hours one week and 30 hours the other and 15 hours one week, that big difference in your work hours could mean that the state won't count you for that period of time. So if you have like, if you're an hourly worker and you work over the accepted amount of hours, you work more than part-time for 6 months, and then Medicaid says, "Yep, you're good." The next time you go back to your eligibility determination, if you worked less than that, they can kick you off. So that's another reason why the additional layers of like eligibility determination is really bad, but especially for people who have low incomes, because most people on low incomes they have a lot of variability in their hours. They might do seasonal work, they might do a whole bunch of other things, but it means that they can't stay on for an entire year. They have to keep proving it over and over and over again. And typically people get caught eventually on something. And then they have a lot of trouble getting back on because it takes a lot of work.
It
Yeah,
is now approaching
the administration of that system is going to be very expensive.
It is
it
expensive.
is now approaching 7:45. I think
Yes.
we need to
We
move
better
on
do
to
the
our
next speaker.
Yes,
Yes,
we
please.
could go on. Yep.
Nancy?
Thank you. So I will now introduce our second speaker, Barbara Safaris. Barbara is an independent consultant who has worked with people with disabilities and their families for over 49 years. Barb has a master's in arts in speech language pathology. She has worked in a variety of roles, including as a direct support professional, a speech language pathologist, service coordinator, and in administrative positions. Barbara's youngest brother had a developmental disability and received supports from Medicaid. Barbara?
Thank you so much. Good evening, everybody, and thank you so much for having me. So I'm going to focus on the impact of Medicaid on services for people with developmental disabilities. And a developmental disability is something that occurs before age 22, and it impacts a person's ability to get through daily life. So my brother had cerebral palsy. He needed total care, needed to be dressed, needed to be fed, needed to be positioned. But lots of people don't have that level of need for support. And if you think about developmental disabilities, some common ones are autism, Down syndrome, cerebral palsy. Think of maybe if you had kids with disabilities in your school, they probably had developmental disabilities. And for them, Medicaid is not just the health insurance, helping them get the medical care that they need and access, but there's also something called a Medicaid waiver. And it's also known as a HCBS, Home and Community-Based Services Waiver. A lot of those people with disabilities need help every day. Maybe they need to be like my brother, dressed, positioned, fed, bathed. Maybe they need help getting dressed. Maybe they're not literate. Somebody typed a comment in chat. And so it impacts their ability to do things during the day. A Medicaid service that is available for people who need assistance is institutional care, like nursing homes or intermediate care facilities or institutions for people with disabilities. If someone doesn't want to be supported in an institutional setting, they can ask for a waiver. They waive that Medicaid service to receive supports through a waiver in their home, in their community. Maybe they live with family, maybe they have their own apartment, maybe they live with a couple of roommates or housemates. And this allows people to actually be seen as valued, be part of their community, be valued members of their community, not be segregated, and have the support they need so they can be active in their community. Many people with developmental disabilities work. They may not work 40 hours a week, but they work. And so in order to get a waiver, you have to be eligible for Medicaid, but you also have to have an assessed need for supports. So not everybody with developmental disabilities is going to get a waiver, only people who have an assessed need. And as with Medicaid, this is funded by a partnership with the federal government and the state or local authority. The match for waivers is a little different. It's not 90-10. And I'll talk more about the match when I talk about the waivers for people with developmental disabilities. So really the benefit of a waiver, the plus is that people can actually live in their own home. They can be in the community. Sometimes a waiver will actually pay a family member who's willing to provide that care, which is wonderful because a lot of people who are caregivers may not be able to work full time because they have to take care of their loved one. And if they get paid to provide that support, then it's keeping their loved one with family, with people who love them, with people who care about them, and with care provided by people they know and trust and will be consistent. There are waivers in 3 Ohio departments. I'll talk more about the Ohio Department of Developmental Disabilities, but there are 45,500 people with developmental disabilities in Ohio who get support from a waiver. The Ohio Department of Aging also supports people with waivers, and they have 2 waivers, assisted living and passport, again, to help people stay in their own home and not have to go to a nursing home. And the Ohio Department of Medicaid supports almost 43,000 people. So that's a total, an unduplicated count of 111,000, over 111,000 people as of March 2025. And I got the statistics from the Ohio Department of Medicaid. So the waivers for people with developmental disabilities, people have to be eligible for Medicaid. They also have to be eligible to receive services from their county board of developmental disabilities. Every county, all 88 counties in Ohio have a county board of developmental disabilities. They were set up by House Bill 169 in 1967. And those county boards provide supports to people with developmental disabilities that are eligible. So not everybody with autism may be eligible. Not everybody with Down syndrome may be eligible for county board supports or services because maybe they don't have support needs in daily living supports. The local match can change every year. For the DD waivers, in my entire career, it has usually been 60% federal, 40% local. And the local match is paid usually by the county boards, which is why they have levies. They get property tax levies. They use those local dollars to leverage the federal dollars. And there are 3 different waivers. They all have caps. They all have rules. And people have to be assessed to be eligible for supports. The 3 Department of Developmental Disability waivers, there's information on the website. There's a self waiver, which helps people manage how the money is used. because they might be able, if they have a self-waiver, maybe they want to be able to hire people and train them. And they can manage their budget. You know, I want to spend this much on transportation. Level one is for people who don't need many supports at home. They might be living with family and just need some assistance every so often. And people who have an individual options waiver probably need a lot of help. Their services are determined by a plan. They're assessed annually by the county board. They have we call them a service and support administrator, in other words, a caseworker who works with them, develops a plan, authorizes the money, authorizes the providers to provide the supports, and then monitors to make sure the services are provided as they've been authorized. There are many, many rules about the payment rates, how often people need to be assessed, what assessments need to be used, and what the services are. And what I thought would be interesting is just to show you some of those services that people can access. So homemaker personal care, people who need care at home, maybe they need help with bathing or cooking or maybe housekeeping, maybe grocery shopping. Ohio shared living is when someone lives in a family home. It could be with a family member, somebody that they're related to, and that provider treats that person as a member of their family. They are considered a member of their family. So think about the foster care model. You know, it's almost like adult foster care. But the waivers will also pay for equipment. It'll pay for nursing. It'll pay for nursing delegation, where a registered nurse will train a provider how to how to dispense medication. They can use the waiver dollars for transportation, for non-medical transportation, for someone helping them to find a job and keep a job, for day services. So you see, there's lots of services that people can access. My brother had cerebral palsy. He needed a custom fitted wheel power chair, and Medicaid paid for that. Medicaid will pay for glasses and hearing aids. And there's a cycle. They'll only replace every so many years. But they'll also help provide nutrition supports, money management, any kind of assistive technology or home modifications. And for the people who need it, behavioral assessments and supports. So that was a quick presentation. Do you have any questions for me? And I hope I could answer them. But I really, you know, people think of Medicaid and they think about the appointments, going and getting health care. And I just wanted to show you that, you know, 45,500 people in Ohio have a waiver if they have a developmental disability, and that supports the family to support their loved one.
Thank you, Barb. I see one hand raised as Arlene.
Okay.
Thank you for such a great summary. I spent many years of my career with facilitating the waivers, especially the individual option waivers in Southeast Ohio, and was insistent that family members be able to be paid to get this, because having somebody in your home when you're trying to get ready to go to work yourself and other things, and people you trust, was very hard. And that was so wonderful when the department did that. And I was determined that the kingdoms of Cuyahoga, Hamilton, and Cuyahoga were not going to take all of the state's money, and these were given in slots. So I was racing to get families in the waiver. The wonderful thing, it waived the family's income so that This
Yes.
was based strictly on the person with a disability. And so I was able to reach out to, professional people and the working people in the community, middle class people who are not used to interfacing with our Department of Job and Family Services and having to be subjected and to be strengthened to know that it's worth it to go through that, to acquire the services, and being able to see that people who are in the least restrictive environment and that getting advantages within their own community, and this is why I am so terribly concerned about cuts to Medicaid because there are these thousands and thousands of people and their families that I can't imagine what will happen. And it just shows the total disregard that people in power have for ordinary people in families right now, and this extreme fascism that's taken hold, that we have to keep doing what we can to prevent more damage.
Well,
So
Arlene,
thank you
thank
for
you.
what you've done.
Oh, thank you for all you did, because I was like, they're not going to understand this. But thank you for all you did to advocate, because it is very different when you have someone coming in your home and you never know if they're going to show up, and and to have the opportunity for families to provide that support and get paid, because a lot of families can't work full time because they have to provide the care, and 45,500, but trust me, that is not the total number of people that the county boards in Ohio support. It is probably double and a half more than that.
Another thing, it's a great jobs program for the people working. Like back in the 1980s, people could be paid $12 an hour. Now, they didn't get benefits beside this, but so that the payment schedule for independent contractors or family members was decent.
Yes, and there's been legislation to increase the wages, and a lot of advocacy from provider agencies and families so that they have more consistency. So thank you for all you've done. And this is why county boards, because they have to encumber 40% of the cost. And the average cost of a waiver, according to the website, is somewhere in the 60,000 a year, but that's less than nursing home costs. And if any of you have had to support a family member going into a nursing home that didn't have Medicaid, I know my mother needed, so I actually had to help her get in a nursing home, and private paid because she was not eligible for Medicaid for a while. So 60,000 is nothing to help someone stay in their community and be an active member in their community. People work, they go to day program, they volunteer. And a lot of people with developmental disabilities take care of their older parents. So, which we don't recognize and understand.
Yes.
So I
And the
see
work
another
ethic of
Yes.
people with developmental disabilities, you can't get them to take a vacation from their
Yep.
job.
Yes, you are correct.
Dee, do you want to ask your question? Oops, there you go.
I have two questions. The first one is for somebody who is going into assisted living, they they have to be, the two requirements you said, they must be eligible for Medicaid, which means financially eligible, I assume, and then the Department of Developmental Disabilities has to approve. And is that correct? Because if you have, if you just are aging and you're having difficulty with, you need assistance with certain things, you don't necessarily have a developmental disability.
Correct. And those waivers are under the Department of Aging, and I truly don't know the requirements. The passport waiver that's for aging or the assisted living waiver. I have worked in the field of DD for my entire career, and my entire life has been, having a sibling 4 years younger than me. So I'm more familiar with the DD requirements. But if someone has a developmental disability, yes, they have to be eligible for Medicaid, and then they have to be eligible for county board services. So there are some people who have a developmental disability, but they know how to handle their money. They drive, they have a full-time job, they don't need help. So they may not be eligible for county board because they don't have a need in daily living areas.
Okay. But somebody, so just let me clarify that. So somebody that's going into assisted living because they can't handle their medications, they need help getting around, they either have to get it through passport, or what was the other?
Let me flip back. I don't know what would, you'd have to see what the qualifications are. I'm sorry, hold on.
Let's see.
The Department of Aging has 2 waivers, and then the Department of Medicaid has My Care Ohio and the home health care waiver. The home health care waiver usually is for people who have significant medical needs, need supports.
Okay.
So I'm not sure the person that you're talking about which one would be.
Yeah, I see what you're saying. Okay, that helps. And then my second question is the bills that are being, as we speak, considered on the federal level and the Ohio bills, are they, if they were enacted, would either one of those or both affect the 60-40 ratio for waivers?
I don't know if it would impact the ratio. The ratio is based on the state's per capita income. So every state is different. A state that has a lower per capita income, there are some southern states, their match might be 80-20, but Ohio, it's typically been 60-40. I think the fear that we have is that we have heard across the board cuts. And if there are across the board cuts, that means the 60% that we get will be cut, and then maybe we can't support as many people.
I see. Okay, so, and then you said that's reassessed every year, the 60, how much the state.
The federal match?
Yes.
I'm not sure how often the federal match is determined. I thought it was annually. Maybe Kathryn knows for sure. I don't, because the matches seem to be different for different Medicaid services. Oh, Kathryn left.
Kathryn had to.
I'm still here, but I have to leave. I just wanted to come in and say hi. Thank you so much for having me. It was really nice to meet all of you.
Well, thank you so much, Kathryn. And yeah, take good care. And yeah, thank you so much.
Thank you, Kathryn.
There were a couple comments in the chat. Brian's been making some comments here, and I agree with everything he said. But the fact that we have like hundreds of millions of dollars in our unclaimed funds in Ohio, and they want to use it for a football stadium instead of Medicaid. So that's one question. If anybody wants to make a comment about that, but I think it was basically a comment, which I totally agree with. And then the other person wants to know if you could send us references to learn more about that franchise fee that you were talking about. Oh, that was Kathryn. So maybe she could send us some references so we could learn more about the different issues.
I see Arlene has her hand up.
Yeah. Yes. Right now, I understand there are over 700,000 Medicaid recipients in Ohio who are at risk. It's just mind-blowing. 770,000 people that could lose their lifeline.
Well, and we didn't get a chance to ask Kathryn this question, but maybe Barb would have some thoughts too, just about how Medicare for all would help in these situations. And I know for Medicaid, in general, people when they change states would be affected, and so that's obviously going to be they'll be affected by any federal changes here too. But eligibility, proving eligibility when you change a state, or having to disenroll in one state and then re-enroll in the next one is going to drop some people out as well. So, Linda, did you want to ask a question?
Well, when you talk about that, then it's more than, I guess it is a question, because Kathryn mentioned that a large number of the people that on Medicaid actually work, but they're not getting insurance through their employers. So is there anything going on in legislation, state or federal, that would require it sounds mostly like service industry jobs and low wage jobs to offer healthcare benefits? I personally don't think employer-based insurance is the best option, but if we're going to lose coverage through Medicaid, is there any balancing of that? Or do we have a percentage of how many of those Medicaid, the 770,000 people that are at risk, how many of them are already working that perhaps should be getting it through employer-based if that's going to be the primary model for health insurance?
I think that Obamacare originally mandated health care. And I think it got whittled down to the big companies that had a lot of employees were going to have to give health care, whereas the smaller businesses, they weren't going to force them, from what I remember. Because some small businesses can't really even afford it. Some little restaurants and little, you know what I mean? It costs so much for healthcare. That's why it shouldn't be work employer. It should just be Medicare for all, where all of us have insurance through our taxes and not through jobs.
I believe that insurance was mandated for companies like over 50 employees. I don't believe it went down much below that by Obamacare. So that was never demanded by Obamacare for companies with fewer employees.
So did the second presentation point out that if the Ohio Health Plan is implemented, that besides making access to health insurance is, and care, the ability to go to the doctors and get the service you need at the doctors, does it take into the account the need for waiver programs and in-home services? Things that are currently covered under waiver, when they shift the funding from Medicaid to the Ohio Health Plan, what would happen to people that receive home health services or in-home support?
That would have to be dealt with. I don't think there's anything in the Ohio legislation to cover that.
Well, that's interesting to know. Yes, that's a very big program then with the waivers program. It's a substantial help for people.
I'm sure it could be negotiated in. I think it could be negotiated into the Ohio healthcare plan, but it would have to be done.
So, and with the waivers, there's an income eligibility caps. Barb, are there?
For the developmental disabilities, they have to be eligible for Medicaid and they need the services.
Okay.
So if they have a job and earn money, they're not going to lose their waiver, but their Social Security payment may be impacted if they get SSI. So, and people who have jobs who have disabilities and receive Social Security, We make sure they have benefits counseling so they know they can make up to a certain amount and not lose their benefits. Or what they can do with their money. They can, put it in an ABLE account. There's, it would be a person by person conversation.
Arlene, I see your hand.
Any service by a registered, licensed, or certified provider, which would include all the therapists who are involved as part of the waiver, that medical related part, they would all be included, speech and hearing and OT and PT and those different kinds of services. But doing recreational things for one's mental health and all of those other good companion pieces that are important in well-being are not right now on the horizon.
They're not in the Ohio bill.
Yes. Transportation, I think it is
Transportation
for
is
medically related.
for medically related. Yes.
And the Department of Developmental Disabilities manages the waiver, the three waivers that I mentioned. And they have their own departmental budget. So I have not heard that there will be any impact on the waivers, but who knows?
Yep.
Well, I'm going to take a moment, unless Barbara, do you have anything you'd like to say, sort of wrapping up your?
No, just thank you for the opportunity and just thank you. And thank you for your questions and all your advocacy work.
Well, thank you for being with us.